Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. The patient in this procedure attended with bilateral wet sloppy earwax, and we're just in the left ear and I'm just performing microsuction using a standard Zollner suction probe. So earwax can be categorized as either being dry or wet, and what determines whether you have dry or wet earwax is a mutation to a specific gene. And this gene is the ABCC1 gene. If you have a dominant guanine allele, so for those of you that know about your nucleic acids, there's 4 adenine, thymine, guanine, and cytosine, I believe the last one is. So if you have a dominant guanine allele, it gives you the gene, the wet earwax gene. So with that dominant guanine allele mutation, you have modified sweat glands called alcopine glands, the same glands, sweat glands, as you find under your armpits. So in theory, if you have sweaty armpits and body odor, you are very likely to have also wet earwax. If you have 2 recessive homozygous adenine alleles, that means you've got the gene for dry earwax. They are obviously inherited, and you can if you look back at the genetic roots of these gene mutations, people with from a African or European descent generally have the wet earwax gene, and people from the Far East or North America generally have the dry earwax gene. So just a bit of trivial knowledge there. So we finished off the left ear. There was a bit of dead keratin left in at the base. We left that. It wasn't significant enough for me to remove. It wasn't infected, and we just run the risk of clarinetting. So clarinetting is when we suction skin, it can emit a very loud, high frequency squeal. It's not only deafening for the patient, but also for myself, the clinician performing the procedure. So we left that behind. Sometimes less is more. It's something that I always teach our ClearWax delegates. We had a training course this weekend, and we have to stress that. I couldn't stress that enough, really. So just on the right ear, again, it's wet sloppy wax. Obviously, as I mentioned, they've got this gene, the wet gene, but despite it being sloppy, the wax came out a big plug. The eardrum is nice and visible. It's just a bit of wet wax just near the entrance, laterally, just on the posterior part of the ear canal. Just using the suction just to gently remove this sloppy earwax. And in a minute you should see some still images of the 2 large plugs of soft, wet, sloppy wax that I extracted. You can just see how wet it is and sloppy it is. It's also attached itself to the Zollner suction probe. They're the 2 plugs. I think the one on the right is from the left ear, the larger of the 2. Patients really obviously could hear significantly better post-procedure. I hope you enjoyed that video, guys, and you're all keeping well and safe wherever you are in the world, and I shall endeavour to upload some more videos in the upcoming week. Take care, bye.